Hi, this is Princess Osita Oleribe. Very briefly, I'm going to be presenting to you the topic health equity. In the wake of COVID 19, a lot of attention has been paid to issues around equity, diversity, inclusion, and that's because the differences in outcomes and risks that the pandemic brought to the fore were just difficult to ignore. I have this a beautiful image here from Minnesota. It's a health equity coalition in 3 counties in Minnesota. They try to depict here an image of uh, equality and equity. While equality sounds fair, equity is actually fair. The difference is not everybody needs the same thing, and so being deliberate about the individuals involved and making sure you're meeting them where they are at would be necessary if we're going to achieve fairness. Not everybody needs the same thing. Let me very quickly present learning objectives. We're looking at 4 learning objectives. These are based off of your course outcomes. If you're not familiar with it, I want to recommend that you go back to your course syllabus and look at these course outcomes that are outlined in this screen on this screen rather. So we have first of all, learning objective to define health and health equity, differentiate between health disparities and health inequities, describe drivers of health in communities or population groups, and then lastly, analyze determinants of health and their relationship to health risk and health access, and as well as health outcomes of population groups. Now, you have heard this topic over and again, but I always like to go back to it. WHO defines health as a state of complete physical, mental, and social well being. Now, it's important that this is a multifaceted uh, look at health. It's physical, it's mental, it's social. Even then, when you look at these things, you can break them further into other components. But before we leave this definition, it's important to note that it is not just the absence of diseases, it is this well being in so many different areas. And health equity actually goes off of this definition. It's saying everyone achieving a fair and just opportunity to attain the best health outcome possible for them. And this is a definition by the CDC. We're going to look more at what this means in practical terms. Now, what are the things that affect people's health? Knowing well that health does not just mean disease and infirmities, absence of disease and infirmities. It's important to look at what are those other things that lead to mental, social, and physical well-being. WHO categorizes them into 3 main categories: social and social, cultural, and economic environment. It also looks at physical environment, and then it looks at individual characteristics and behaviors. Now, it's very easy to pin down an individual and maybe find ways to attribute their sickness and disease to their own genetics, their biology, or their behaviors. But there are many more things that go into the health determinants of that person. For instance, when you look at the issue of physical environment, you're looking at safe water, clean air, healthy workplaces, safe houses, communities, and roads. And these things have a direct impact on people's health outcome. And it goes through phases, right? It's the risk, then is also shows up in terms of their access to health care, and then the health outcome that they receive. When you look at issues of social, cultural, economic environment. We have a whole lesson on social determinants of health. It is so many different components, as we'll see in the next slide. But individual characteristics are things we're very, very familiar with. Issues around male, female, gender, right? Or it's even sexuality, as the case may be. It could be your genetics, it could be your habits and your care or health seeking behavior or even health coping mechanisms that people adopt. All of these things go a long way to affecting what the eventual health outcome the person has. Now, this is a very common image of social determinants of health. It looks at five major categories. In some other categorizations, you'll find them in six, or five and six is the most common categorization of social determinants of health. But in any case, it touches on many of the things that you may have heard about in different places. Now, the broad categories in this image is the health, education and access. Education access and quality. So people's education level affects what they value and what they adopt in terms of coping with illnesses or preventing illnesses. And now it doesn't mean that people necessarily act on the basis of the education, but it has a significant influence in how they take to it. The kind of health services that are available to them, the quality of health services available to them, the kind of neighborhoods they live in, and this in some way touches on the physical environment which we looked at in the previous slide. Also, the social context that people live in, their community, their in some ways social well-being plays into their health and how they respond to issues around their health. Economic stability definitely has a huge part to play in how people access health and how people turn out also when they are faced with health situations. Now, this is an image from Boston Public Health Commission. It's an image of racial justice and health equity initiative. Now, the point is, we can talk about the categories of health equity, of social determinants of health, and talk about how they lead to health outcome. This is a broader category, right? It has things like transportation, things like food access, and you can find ways to group these different components into the five broad categories of social determinants of health we just saw. But the important thing is to know that racial justice has a lot to do with all of them. So issues of racism, sexism, ableism, homophobia, transphobia, xenophobia all play a part in all of these determinants of health. And I know this is not just racism, of course, it is all the many other human behaviors that influence how individuals take to seeking health or even coping with health situations or preventing a health condition for themselves. Ultimately, it leads to health outcome. It leads to health outcome primarily for individuals, but then it doesn't stop there. It paints a picture of the health outcome of the population and paints a picture of the health outcome of states, of nations, and all that. When we looked at social determinants of health, we looked at how people's zip code could suggest their life expectancy. And so these things matter a lot in the way we live, in where we live, in who we engage with, and how we engage with people. A further look is a framework for health equity, looking at socio-ecological factors before ever you get to the hospital, before you get to the individual's genetics or healthcare access in those communities. You're looking at upstream public health issues. So when we talked about race, for instance, or even sexism or xenophobia or homophobia, whatever it is that human beings take to, a lot of these things have a lot to do with how people turn out, and it shows up in different ways, right? It shows up in the ability of governments to take care of their own people, or corporations to protect the environment or the living conditions of people. It affects how people end up on the streets, or end up in situations that make them more vulnerable than others. It has implications in the segregation of the living situations of people, where people get to walk, how healthy it is, and all that. So before ever you get to the hospital, people have issues that expose them to so much risk and danger that even getting to the hospital may not be a solution. Very recently, the issues around bomb pit was in the news, the military and the conditions that people face, and what that has meant to them, turning into cancer, turning into problems that are really even impossible in some cases for healthcare systems to handle. So ever before you get to the medical model, there are a lot that goes on and could be intervened by governments, by communities, by authorities, or even groups that have power. Now, let's look at the health systems. Even getting to the hospital does not mean that you would have access to the kind of care you need. A lot of people who live with chronic conditions know what that means to their lives, and how much goes out of their paycheck every month, or goes out of their savings, or maybe what they can ultimately afford or not afford in taking care of themselves. But it manifests in other ways too. It manifests in how long people live. It manifests in infant mortality and issues around maternal and child health. The I don't know if you feel the sadness in some of these issues that we're talking about, and this is highlighted in the next slide. Look at this. Health disparity is differences in health, right? Is it's because people are different or at different stages of their life, but health inequity is not the same. It is worse. And how is it worse? It is unnecessary. And so, going to the point of the sadness I was referring to in looking at that a whole framework and how people fall out of the ladder at different points, is unnecessary. It's not just unnecessary, it's avoidable. So looking at those unfair and unjust systems and roadblocks that are in the way of people attaining their best health outcome possible is when you're looking at health inequity. So just the mere difference between one thing to the next does not necessarily mean there's an inequity there. For instance, an older person is more exposed to chronic diseases just by reason of their age, right? By reason of wear and tear on their bodies. That wouldn't be the same for, say, a 20-year-old person. That's just a factor of their age, right? Or not just a factor of age, but hugely a significant portion of it. It's also for instance, when you look at issues of childbirth, a male child may have more bone density than the girl child, and so comes out with heavier weight than the male child. The female child, it will mean that the mother did not feed as well in pregnancy for the male than the female. No, it's essentially the issue of their biology and some of those differences that exist. But what does health inequity look like? Health inequity is more of avoidable and unnecessary challenges that people have to pass through that lead them to having outcomes that are different. Right. Now, look at this example that I have here. I want you guys to think on these different situations and think through some of the things I've said to you and tell me, you can say that to your teacher, if one thing is health disparity or is health inequity. Remember, the difference between one and the other is that these are just simply differences. These ones are avoidable, they are unnecessary. Issues of race, for instance, does not mean our biology is different, or is all of those extra exposures that people go through that lead to where they end up in life. Anyway, health equity in action, it's different things, right? It is data and research, it is policies and guidelines, it is programs and practices that are put in place to intervene. This is how you turn those unnecessary situations, unavoidable situations, to cause them to go away so that people can attain their best health outcome possible. Let me give you an example of some of those things that are in place. CLASS, for instance, is an intervention that the federal government set up for health intervention especially in healthcare settings. It doesn't have to be hospitals, it could just be health plans working with CLASS standards in their work. There are about 15 CLASS standards, and I put a link for you to be able to go look at them, but these are the broad categories of the CLASS standards. Now, CLASS is culturally, linguistically appropriate services. The principal standard is that you provide effective, equitable, and understandable, as well as respectful quality care to people. Now, it doesn't matter what their race is, or their beliefs are, or what their physical or social dispositions are. You have to meet them where they are at. And there are other categories for the rest of the standards that are grouped under governance and leadership and workforce of the institutions. A lot of times people want to see people who look like them, but it's not just because they want to be relatable with them, but it's also because some things are lost in transmission. I have a friend when I lived in Oregon whose father driver's license was suspended because his communication with the healthcare worker was lost in translation. And so it matters who's working in those facilities, who's engaging with human beings. There are direct implications on their lives. Anyway, CLASS also reflects on engagement, on continuous improvement, and accountability for individuals. It is also in the communication and language assistance that people get in their care. Now, why does health equity matter? You can read off what I have on the screen. Ultimately, when we look at health equity, we're improving the population's health. And when the population health is improved, there is more viability in the economy, there is more harmony in the system, all that sense of disenfranchisement and not being part of the society is much reduced, and people have the liberty to fight for the things that really matter to them. And so when we talk about health equity, we're talking about everyone, everywhere, getting the best health outcome possible so that we can free ourselves to fight for other things that will make this world a better place for all. I hope that you have opportunity in future to be in positions of authority where you begin to make policies and to research and intervene in programs and practices that will make the difference in improving the health equity of the communities where you live and work. Thank you very much. Any questions, feel free to raise it to your teacher, and I'll be happy to help in every way possible. Thank you. Bye.